which will result into epilepsy. Then also, if you have like cerebral malaria, we have seen so many people from Eastern. You know, Eastern Uganda is the area that is most prevalent when it comes to malaria. So there are more cases of cerebral malaria. Cerebral malaria means you have malaria of the brain. I think in the layman, that's what it means. So that sequel can also result in what? But also we have seen traumatic causes. Someone gets a road traffic accident, okay?
Somebody is beaten.
He gets head injury, traumatic head injury. So in a long term, it predisposes you to a risk of becoming an epileptic. But again, and should be the most important, I think when we are talking about epilepsy, because most of these things, infectious, yes, we can prevent, road traffic accident, we can prevent, but the most critical area is what we call, actually, most people are predisposed prenatal when they are still inborn. Because so that's why we call upon mainly for antenatal or prenatal care. When people are pregnant, the brain is more fragile. So if you get infections, what we call the torches, okay, that are transmitted vertically from the mother to the child in utero, then should this baby get any trauma to the brain, the risk of developing epilepsy is so high. So that's why we are calling out pregnant mothers and all the people listening that it is very, very important for people to do antenatal care, because that's when the brain is on. So prenatal and also birth complications, okay? You have heard of birth asphyxia. There's a condition we call hypoxic ischemic encephalopathy. So if the brain is deprived of oxygen at birth, okay, then it has a higher risk or higher threshold of getting epilepsy. So prenatal, but also there are some other risk factors like genetics, okay?
Does it move in the blood?
Does it move in the blood? It's DNA. That's why, like, okay, there was someone in the family, and again, no one can explain why this lineage can get people with epilepsy, whereas, okay? So genetics, again, you need to understand that sometimes genetics require an environmental trigger. Because if you have genetics, it means your brain has a less threshold for developing seizures or epilepsy. So should you get another trigger that is environmental, it increases your risk. So even if we cannot control genetics, at least we can minimize other preventable risk factors. And again, I also want you to know that there are some cases that we call idiopathic. We can't explain. Okay? There has not been reasonable to explain why these people or why this person has developed epilepsy. So still, it all goes back to seek appropriate care, let doctors make timely diagnosis and also treatment. Thank you so much.
Wow, wow. I've just been listening so keenly because I'm a student and I want to learn better when it comes to such conditions that are notorious in the community. For viewers who just joined us, you are live on Google Data Vision Health and Beauty program. Do not get lost. We are talking about epilepsy. What does it mean? The causes, the risk factors, and how best can we distinguish epilepsy from other diseases that cause a seizure. And we've just learned that epilepsy has its own way of knowing it because of its unprovoked seizures. I mean, they come on their own, whereas other diseases can provoke a seizure, but for epilepsy, they are chronic and they are recurrent. So of course, we want to once again appreciate you for watching Good Data Vision. We want to encourage you to visit our social media platforms, Good Data Vision Uganda on Facebook, LinkedIn, TikTok, and we can learn together about epilepsy. Now, we want to talk about, now there is what we call the mothers who take care of these children. What are some of the learning stories? You know, we are trying to transform stories into action that can inform policy. You've heard about some stories from mothers who are taking care of these children, maybe families with these people with epilepsy. What are some of those stories that you'd want us to know about?
Like the message to the mothers, or
any story from experience for a person who has lived with epilepsy.
Okay. That's a good one. One, of course, just like any chronic illness, like I've said, the most interesting are those misconceptions, of course, which hinder adherence to the drugs. Because if someone has a belief, very many believe about the misconceptions. You know, even if my child is epileptic, I know there is something to do with family, okay? Evil spirit, things like that that we have already demystified, okay? So it is very important for people to know that those misconceptions are not. So very many mothers who come with epileptics, and of course they will come with recurrence because that will affect the way they adhere to the medications we give them, the anti-epileptic drugs, because they have a second source, okay? Then many are asking about, but can this condition be completely healed or cured?
Yes.
Okay?
Can herbal medicine support it?
No, not at all. No herbal, not herbal medications. Whereas the anti-epileptic drug that I have said, very many people can live seizure-free when they're on medications. So when they live seizure-free, the caretakers stop medications because they no longer see their children. Then they get a trigger. Like I've said, once you're epileptic, your threshold for developing, for getting a seizure is low. So any small trigger will put you into what? A conversion. So it is important that they stay on medications. So those are some of the many stories. Some really are looking for complete cure. So they do alternative medicine, they go into herbal medications, they go into witch doctors, okay? But yet it is just a disease, okay? Just like any disease that has a management strategy, not cure, okay? Not cure.
How best can we access these services, especially for the local communities? And where is this disease actually diagnosed? We can talk about now the diagnostic criteria of epilepsy.
Thank you so much. When it comes to making a diagnosis, much of it is actually clinical, like you have heard from the definition.
Yes, from the...
A seizure, as long as someone has witnessed a seizure and they know what a seizure is, maybe a medical personnel, a healthcare provider, and then it fits this category, you can diagnose. But for those who are actually, okay, still not sure, is what we call a brain EEG. It's an imaging that captures the brain activity, okay? Because during a seizure, it's an abnormal activity. So that is a more of a gold standard diagnostic tool that we use to say you are epileptic, because we can do a brain imaging. But brain EEG, for example, is not available. I think here we have one in Mulago, we have one in Mutabika, there are few. So, and we know care, the point of care. So very many people will not get a chance to do what? To access a brain EEG. So still, it is something that can be diagnosed clinically. And care is everywhere, beginning from a health center for, because anti-epileptic drugs are there and doctors are there to manage these conditions. Of course, like I've said, once you have epilepsy, you need to understand that if you manage appropriately, then the patient will lead a normal life. Like you asked, can an epileptic be married? Can an epileptic? And also, this is very important. You don't put other people at risk, because if you have epilepsy, of course we didn't talk about the types, there are so many types, but if you have epilepsy and you're not on medication, you don't know when the seizure activity will occur. So assuming you're a driver, okay, and you get a seizure, obviously that's an accident, okay? Or you are cooking. So we also tell people who are living with epileptics, because you never know when it will happen. So to keep a watch, because very many people who come with burns, okay, home accidents, in other words, you find that is the first time they know they're epileptic. Or the epileptics not on medications, poorly controlled. And then you go ahead to expose them to such risk activities, because you don't know when this abnormal activity will occur. Okay?
Wow.
So it is important that even those who have epileptics, they learn about how to prevent complications like home accidents, things like that. So it is very, very important that people know, they seek appropriate care, and adhere to the medication so that you can live seizure-free for as long as possible. Thank you.
Now, thank you so much, Dr. Tukashawa. Now, dear viewers, we are still learning about epilepsy, and the most key information I've had at his tail end is that we have to make sure we prevent risk activities to the persons who are living with epilepsy, because we can't tell when or what time will the seizure activity come in. And of course, this affects the performance, and accidents have increased for the persons living with epilepsy. We take a short quick break, but when we return, we'll discuss more about prevention and treatment modalities that are available for epilepsy in Uganda.
Good Day TV, transforming your life.
Are you a resident of Wakiso, Nansana, Senge, Namusera, Kampala, and other neighboring areas looking for a school with a modern, comprehensive learning environment, qualified and caring teaching staff with a trustworthy support team? Look no further. Take Time Kindergarten and Take Time Junior Schools develop your child's learning capabilities to greater heights in a God-fearing setting. We nurture leadership, responsible citizenry, academic and co-curricular excellence like sport, swimming, and other activities. We offer pick and drop services for our learners in our clean fleet of shuttles. We also have both day and boarding options. Registration is in progress from kindergarten to P7. Contact us via phone or WhatsApp on 0784 448833 or 0743 448833. Find us at Naluvule Senge along Kayunga Kawanda Road. Take time, lead to excel, and excel to leads.
Don't miss on Guguda TV.
From Woman Blossom annual getaways, the summits, the planning and prayer retreats, we bring to you an amazing Woman Blossom TV show. In a world where women are demanded so much, it is time we paused, healed, and blossomed. Join me, Giftina Kayinga, every Sunday, 5 p.m. live on Google Day TV as I bring to you an amazing Woman Blossom TV show.
Don't miss on Guguda TV. Guguda TV, transforming your life.
You are most welcome back from a short quick break, and we've been talking about epilepsy. And of course, now we want to dive into the prevention. If you followed us when we started this important program, you realize that epilepsy is an interesting case that needs a multidisciplinary approach, that needs an awareness of the family members, of the relatives, and of the persons living with a child or a person who has epilepsy, because it is an interesting case, just like I said, and anytime a seizure can come in and things change or they become different. And we wanted to look into what are the symptoms before we go into the prevention. How do these people actually prevent? How can one tell that this person is actually having an epilepsy? And then now we need to be keen and pay attention to this important person. Dr. Seb.
Thank you so much. And once again, it's very paramount to thank our dear listeners who are still with us up to this very point, trying to learn one or two things about epilepsy. Very important question, symptoms. How do you know that someone is actually is epileptic? A general term epileptic, that one you cannot know, you cannot tell, but you can tell that someone is having a seizure. There are very many forms of seizures, okay? And this goes back to types of seizures. We have focal versus non-focal seizures, meaning focal, like I've said, for you to understand this clearly, Mr. Daniel, we have different roles that the brain have when it comes to execution of motor activity, okay? Even if it means eating, are you saying eating? Drinking. Even there are muscles responsible for that, and they are controlled by the brain. So any part of the body can have a seizure. if that part of the brain that is responsible for that activity is what? So that also means that the presentation will be totally different. From as simple as lip smackering. And that's why it is important when we are taking history, is what we call semiology of seizures. Semiology means you can explain how the seizures occur. We have phases. We have what we call pre-ictal, ictal, and post-ictal phases of a seizure. Pre-ictal means just before the seizure, what happens? All this tell the doctor which type of a seizure or what type, are we dealing with? And what happens during the seizure? Maybe you lose consciousness. Some seizures, someone is not aware of what is happening. Others, you are aware. Something like this, it's a focal, because it is just one part. Or generally the whole body, that's what we call generalized tonic-clonic convulsions. That someone, is kind of feasting all over. So it is very important that sometimes it is just one lip or part of the body, or simple as, abnormal eye movements, rolling of the eyes, because all these are controlled by the brain. So depending on the part of the brain that is affected, then it will reflect the symptoms the patient have. So for a seizure, a convulsion, the answer is, of course, you will see something abnormal. So any abnormal movement is taken as a seizure until proven otherwise. That's that's the top home point. Any abnormal movement, recurrent, is taken as a seizure until proven otherwise. Because like I've said, every movement is having a reflection of the part of the brain that controls that movement. So I think that is it for the symptoms.
Yes.
For epilepsy, it will have to fit into the definition, because I've said all are seizuring, whether it is epilepsy or non-epilepsy. So for you as a caretaker, for you as a human being, a normal lay person, what you need to know is, can I be able to say that maybe this is a seizure? Then you can describe it is a seizure when it happens. And there are also other, like I've said, in ictal phase, when a seizure is actually happening, or post-ictal. Some people roll eyes, some people lose control of their urine control, so they get urine incontinence and fecal incontinence, depending on the part that is. Because all those sphincters are also muscular and they're controlled by the brain. So at that point, when the brain goes bizarre, you can also lose that control. Yeah, some people fast shout. You get? Some people fast shout before a seizure. Like I've said, it cannot be one simple description that this is it. Everyone presents like this. It's about having a high index of suspicion. This abnormal movement, this activity, this child acting abnormal from other children. So it also goes back to when you see something abnormal, especially in terms of movement, lips, babies are even more hard to tell. It could just be just one lip continuously moving abnormally, or one limb, or one leg, or even one finger. If it is just that small. But however small it is a seizure, and it must be controlled. So it calls for keen observation. See something abnormal, sit. Say what? And for those whom are even diagnosed as epileptic, they know. Because they have a similar semiology. They know it may be precedes a fever, or they shout. They know that actually my child is about to go into a seizure. So because they have mastered the semiology of that kind of epilepsy in that particular case. So for treatment modality that we have so many treatment modalities depending on the type. That's why a healthcare worker will take history, understand clearly the semiology. Is it absence seizures? Is it generalized tonic-clonic? Are they focal seizures? Because all these have got different treatment modalities. We have antiepileptic drugs, very many classes, and each of the types respond well to different types of antiepileptics. So the healthcare provider will also understand the type of the seizure or the convulsion they are dealing with, and then give an appropriate medication. In advanced world, and actually also recently, here in Uganda, there are also some cases where we are doing surgery to correct epilepsy. Surgery is more of curative for focal resistant seizures. So there have been also, maybe we should work more around that to expound on it, because some people are doing surgery for focal resistant seizures. So yes, we have medical, but currently it is mainly medical. But for few selected cases, they can benefit from curative surgery. Yes, thank you so much again.
Wow, thank you so much, Dr. Seth, and of course for sharing such wonderful information. Actually, this is more of experience. You've shared more of what you actually see in the field, which is critical for our learning points here to Google Data Vision, where health education matters to create awareness and prevent disease occurrence in the communities. Now, and of course, now I want to dive into the prevention. We want to focus more on prevention because the Ministry of Health focuses on prevention as one way to prevent disease. And before you talk about prevention, is epilepsy a non-communicable disease? And of course, you would actually, because you know, we are very much keen to know which diseases fall here and here and here. And just like I'm seeing sickle cell has new developments, what do you think of the future for epilepsy and other diseases
Thank you.
in the same way?
Thank you so much. Like you said, you know, when I was talking about treatment modalities, I said currently, of course, the developed world has been doing some surgical for some selected cases. So one, as a developing country, we should think more in creating awareness because we said much percentage of the population don't even know that they have epileptics. Okay? And like I've said, once you have epilepsy and you have seizure, they are not treated, you get sequelae because it destroys the brain every time you have a seizure. Some people die, of course, from complications. They seize and then the brain, you die. So it should be on awareness, on symptoms, prevention, and demystifying, destigmatizing the disease. Okay? Then, at a high top level priority policy making, also focus should be on also going forward to catch the other developing world about, like I've said, we have already started in Mbali, there is a center for surgery where few selected cases at Chua, clearly at Chua, where few selected cases that are focal. Focal means you can actually do a brain EEG and identify that this part of the brain is the one that has a defect and the one that causes what? So you can go in and resect that part, but it's high tech. So we should also focus in the future, focus on that.
New innovations.
New innovations. But again, especially this one should be a record in prevention. Antenatal, prenatal prevention.
When you talk about that, I usually want to talk about planning for pregnancy.
Exactly. Preconceptive care. Okay? So preconceptive care, through conception, and even at birth. Mothers, because once you are doing antenatal, all these risk factors can be caught early. Okay? You avoid birth complications, you avoid torches, because you are screening for infections during antenatal, Hep B, HIV, name it all, syphilis, all these, they can cross and cytomegalovirus, all these can cross and hit the brain. And like I've said, the developing brain is very fragile. So these are one of the biggest risk factors. So going forward, we should focus more on prevention because treatment is very costly, okay? And even if it is there, it is for management. Once you're epileptic, you're epileptic, okay?
Wow,
So,
I like the fact that we are zeroing back to antenatal and preconception. Now, what are some of the prevention strategies maybe for children who are already born? Are there ways that these children can get epilepsy, even not away from the parents?
yes, like I've said, whereas I think the proportion, younger children and older adults actually at more risk of developing epilepsy, with of course a few percentage being in the adolescent type. Like I've said, if we go back to the causes, we said traumatic, infectious, okay? You recall? The causes, road traffic accidents. So even you, when you board a judge, put an element, because traumatic brain injury will result into epilepsy in the long run. Children the same, accidents, spraying, you get burns, then infections. So those things that are preventable, they should be prevented, okay? So if you have an infection, you should run because the immunity is low. If you have malaria, get a fever, any fever, run to the hospital because that could be a viral infection that once it's not treated, hits the brain. You heal from the infection, but because of the scarring that stays in the brain, a child is predisposed to getting epilepsy. So still it zeroes back to early health seeking behaviors of parents, because when the child is still below 5, their brain is developing. So anything that hits that brain predisposes it at the risk of developing epilepsy and all other neurological sequelae, not only epilepsy, okay? Also low mental state, okay? So it is very important that any infection be treated with serious what? Remorse. That you should know that it can have long-term complications. You have malaria here, you heal, but because you took long to treat, it caused complications. So it is important. Early health seeking behavior is the key term here in terms of prevention.
Wow. Thank you so much. And of course, for viewers who have been with us since we began this program till this time, we want to thank you. But of course, we want to try once again to join the social media platforms of Google Data Vision Uganda, LinkedIn, Facebook, Twitter, or X. And of course, on TikTok, the commonly one now on videos and whatever, so that you can learn more about this condition and be able to prevent the disease prevalence from wherever you are. Now and of course, now as we intend to come to a closure of this important show, we want to rally different communities. We want to begin with parents. Doctor said, I want you to rally like 5 good points to parents with children who have epilepsy. Number 2, the second community I want you to rally is the health workers, the health workforce team. You know, they need to always have, maybe, I don't know if you recommend CPD, CMEs and whatever, and also early diagnosis, I don't know. And of course now the last team is the policy makers. Me, I believe in policy. Sometimes if we make health education, it should translate to policy. And of course, when you rally the government, we shall leave this place very well. And of course, if there are also other organizations that are working around epilepsy, you can also rally them to work in a unified action.
Thank you so much. Once again, I want to thank our dear listeners who have been with us till this far. So, like you said, always there's a big message to all those categories you have enlisted right there. Parents, both, I will include them, both who have children already living with epilepsy, and even those who do not have children living with epilepsy. Like we have said, epilepsy is a brain disease, the brain disorder, whereas some cases you cannot actually tell they are idiopathic, meaning you can't tell that this person will develop epilepsy, but also a bigger number we have seen they are preventable causes, infections, complications that occur during pregnancy. For example, you get infections when you are pregnant and you don't treat them appropriately, and also road traffic accidents that injure the brain, malaria, so name it all. So early health-seeking behaviors is the key point to you, dear parents. Take your child. Any child in a stage, like we have said, to be specific, anyone from day 0 up to 5 years, their brain is still growing and it is most fragile at that stage. So even if it is just a fever, it could be a viral illness that can result into an encephalitis, which is a disease of the brain that can later on result into a child having epilepsy. Also complications during pregnancy and at birth. So giving birth by a trained healthcare provider will prevent some of those complications that could predispose your child to epilepsy. For those already having children living with epilepsy, it is important to know the misconceptions that we have discussed and demystify this. Know that if your child is getting appropriate treatment, up to 70% of these children will live seizure-free. They will lead normal lives, just like other people, and they will avoid other complications of being an epileptic. And those who have epileptics, be on watch out, because like we said, you don't know what time or what will trigger. Anything small can trigger the epilepsy. Be stress, be lack of adequate sleep. So watch out for them and avoid involving them alone in risk activities like cooking, because we have seen many of them come with complications like burns, involved in accidents. Okay, so it is very, very important. I think that is a message for parents. A message to my fellow healthcare workers, number one is let's increase awareness and let's demystify. Every opportunity with any patient with epilepsy, demystify and also pass on this right information on prevention, on management. Let's spread the gospel of epilepsy so that people know and actually encourage others, because once the general population is not aware of this epilepsy, they will seek alternative means which are very dangerous to their children or to their beloved ones who are epileptic. And also to also help people understand that not every conversion is epilepsy. Some of these things are quickly manageable and totally curable, like we have discussed. If you have like electrolyte imbalances, if you have, so this is our role as healthcare workers to actually make the general public aware, and also it's also our role to press on the policy makers to consider, to bring data. Let's make research and so how big the burden epilepsy is. I know there are many other papers out there, but let's tackle many of these preventable factors so that we focus on more on prevention and management. And of course, the policy makers, okay? Let us give epilepsy also a priority, okay? Because, like we have said, much of this you have heard, we can focus on prevention. Let us put money in prenatal care. I know, I applaud the government. Very many people are now seeking what? They are now seeking, the problem could have been worse because many people are attending antenatal, okay? But also, you have seen the road against malaria. The government is doing quite well. So, let's now also invest in bigger treatment strategies. Let's support CHUA, okay, in terms of surgery. And let's enroll more people and screen more people who can benefit from curable strategies like what? Like surgery, okay? Thank you so much.
Wow, thank you so much for being good viewers of Google Data Vision Health and Beauty program. And of course, we've been talking about epilepsy, and I hope you've been able to learn what epilepsy is from the start, the risk factors, the causes, who is at a risk also actually getting epilepsy, what can parents do. And actually, before we leave, let's talk about a few first aid tips, like 2 minutes first aid tips for these mothers.
Thank you so much, and thanks again for giving mothers an opportunity. You love mothers so much.
Yes, I do.
Thank you so much. So for the tips for those living with epilepsy, one, we already talked about stop the act of pressing a spoon in the mouth. So whenever, I think more of these tips are more of they need to be demonstrated, but it's what we call a recovery position. I know most of these people are educated now. So if they just put recovery position on internet, on phone, they will see recovery position during a seizure. So don't do anything, okay? Just put the patient in a recovery position because there are very many risk factors. There are very many things that can, for example, a tongue might roll back and cross the airway because it is involuntarily seizing, and that can result into a patient actually dying, okay? So it is very important that they learn how to put, like I said, we teach most of these mothers when they come, okay? So when they come in the clinics, on how to put the children in what? But again, like I've said, really, once someone is on the right drug, taking it rightly, it's unlikely that they're actually going to get seizures. They will be free, seizure free. So whenever you have recurrent seizures, and you're on treatment, we have resistant cases, please seek help so that we can try to find out why are these cases resistant. So the most important is understanding which position and what are the do's and don'ts of a child having a seizure, okay?
Yes, please.
Yeah, so when you put them in a recovery position, because a seizure lasts a few seconds to 1 minute. If it is more than that, then it is what we call status epilepticus that require urgent medical what? Attention.
Wow.
Okay.
Thank you so much, Dr. Seth. For viewers, this has been a wonderful discussion between Dr. Seth Tukashaba and I, your moderator, and of course hope to see you next week Wednesday. We shall be talking about other different health topics. The Google Data Vision Health and Beauty program airs every single Wednesday at 9 p.m. and its main aim is to create awareness so that we can prevent and decrease the prevalence of health diseases in the country. See you next week. I am Kamara Daniel. Take care.